All right, so angiogenesis. Angiogenesis is simply the formation of new blood vessels, formation of new blood vessels from pre-existing vessels. Pre-existing vessels. Okay, so that's what angiogenesis is. And of course, angiogenesis is very, very important for wound healing because when these tissues are healing, they need to be vitalized, okay? And so blood will need to flow to them to give them nutrients to proliferate. And of course, angiogenesis also plays a very, very important role in tumorigenesis because as tumors also grow in size, there is need for blood vessels to reach them and provide them with nourishment. And of course, there have now been some therapeutic trials or therapeutic effort to see how angiogenesis can be stopped, particularly with respect to tumors. Okay, so now angiogenesis, like I said, is a very, very important aspect of wound healing. And so we are going to be discussing a little about angiogenesis. Angiogenesis has a process, okay? So there's a process of angiogenesis that involves the first vasodilatation, okay? So the vessel will first dilate, okay? And this is induced by nitric oxide, okay? Nitric oxide, and of course, enabled by vascular endothelial growth factor, okay? So there's first vasodilatation, and then the next step after vasodilatation is the separation of the pericytes, okay, from the vessel wall, okay. So cells that actually surround the endothelial cells will separate themselves, okay. Separation of pericytes from the vessel wall. And then the next step is endothelial proliferation. Okay. And this endothelial proliferation is such that the endothelium will proliferate following a particular endothelial cell that is at the tip, at the leading tip. Okay, so there's endothelial proliferation, okay, behind the leading tip, tip. Okay, and then the next step after endothelial proliferation is their remodeling, okay, into capillaries and blood vessels. Remodeling into capillaries and blood vessels. Okay. Now, before there is endothelial proliferation, there has to be. So I'll change. I'll add another step in between separation of pericytes and endothelial proliferation, which will be the third step. It will be migration of endothelial cells, okay, with respect to where the blood vessel needs to form, okay. So basically let me just see if I can give a graphical representation. Let's say that this is a blood vessel, and we need a new blood vessel in this direction, okay, and we need a new blood vessel in this direction. Now, the first thing that we see that is going to happen is that this blood vessel will increase in its diameter, okay? So it will dilate, okay? So there's dilatation. Now, after the blood vessel has dilated, let us assume that, okay, these are pericytes, these are cells surrounding the blood vessels, and then these are endothelial cells, okay? These are the endothelial cells in these blood vessels. Okay, so these pericytes will begin to separate. They will give way. Okay, so let's put it like this. They will give way. Okay, the pericytes, they will give way. Okay, and allow the endothelial cells they will give way. That's the separation of the pericytes. And of course, there's also going to be breakdown of the basement membrane and breakdown of basement membrane. Okay, so the separation of the pericytes and breakdown of basement membrane. Now, after the pericytes have separated, the endothelial cells will migrate towards where the blood vessel needs to form. Okay, and there's going to be a leading endothelial cell, a leading cell, okay, which is considered the leading tip. And this endothelial cells is responsive to the notch signaling pathway, which actually directs, okay, the formation of blood vessel. So as these endothelial cells have migrated in that direction, we will now start seeing endothelial proliferation in that direction following this leading tip. Okay, we'll see endothelial proliferation in that direction following the leading tip. Okay, and as these endothelial cells are following the leading tip, the new blood vessel will begin to form. Now, that is the proliferation of the endothelial cells behind the leading tip. Now, after this proliferation has occurred, they have to be, these blood vessels will have to be remodeled, okay, so that they can make a blood vessel that is functional. And so there's going to be remodeling of these blood vessels. And then, of course, the sixth one is proliferation of the periendothelial cells, which include the pericytes. Okay, so they will proliferate around it to form an intact blood vessel. Okay, so these ones will proliferate around it to form an intact blood vessels. And of course, the last step is the termination of endothelial proliferation. So proliferation of periendothelial cells and then of course termination of endothelial proliferation. Okay, so these are the steps in angiogenesis of endothelial proliferation. Okay, so like I said earlier, the first step is vasodilatation, okay, and then there will be separation of the pericytes and breakdown of the basement membrane. There will be migration of endothelial cells, and then there's going to be a formation of a leading tip that will direct the next step, which is the proliferation of endothelial cells, so that they will proliferate following that leading endothelial cells. After this proliferation has happened, there will be remodeling, okay, so that the blood vessel will be functional. It will form the normal capillaries and the blood vessel. After that, there will be proliferation of the periendothelial cells, the smooth muscle cells, the pericytes, and all of that. They will proliferate around the endothelial cells to form a very functional and an intact blood vessel. And then, of course, after that, there will have to be termination of endothelial proliferation. Now, all of these processes are mediated by a lot of growth factors. There are growth factors that are responsible for ensuring that these processes go on effectively. Okay, now endothelial proliferation is mediated by fibroblast growth factor, growth factor, I think fibroblast growth factor 3, okay, and then vascular endothelial growth factor is also very, very important in most of the processes involved in this angiogenesis or formation of new blood vessels. Angiotensin 1, and angiotensin 2 also play very important roles with respect to remodeling, okay, into a functional capillary. We talked about the notch signaling pathway, which directs the formation of the blood vessels. Okay, factors like platelet-derived growth factor, transforming growth factor beta will also play important roles in with respect to remodeling of the vessel into capillaries, and also with respect to proliferation of the periendothelial cells. So basically, this is these are the things that play roles with respect to angiogenesis. Okay, now the next important aspect of healing by connective tissue deposition is the deposition of connective tissue itself. Okay, and this is usually mediated by cytokines that are produced majorly by the M2 subtype of macrophages. Chief among these cytokines and the most important growth factor with respect to connective tissue deposition is transforming growth factor beta. Transforming growth factor beta. Now, transforming growth factor beta. Now, we are talking about connective tissue deposition. Now, we are done with angiogenesis. Okay, but let's just continue, okay, as we talk about connective tissue deposition. And I said that the connective tissue deposition is mediated by cytokines that are released mainly by the M2 subtype of macrophages, which you will recall was activated, okay, during the inflammatory process. And these macrophages produce several cytokines, but the most important with respect to connective tissue deposition is transforming growth factor beta. Transforming growth factor beta plays very important role in stimulating fibroblasts to produce collagen, okay, to produce collagen and also to synthesize fibrillin. Transforming growth factor beta also inhibits the enzymes that are responsible for extracellular matrix degradation, which are known as the metalloproteinases. It inhibits those enzymes and, of course, stimulates the deposition of connective tissue by fibroblasts. Okay, so that is the very, very important role of transforming growth factor beta. Apart from stimulating the deposition of connective tissue, it also stimulates the migration of fibroblasts to where they are needed to deposit this connective tissue. And that is how connective tissue is deposited. For remodeling is simply a balance between the deposition of connective tissue and the degradation of these connective tissues. And like I said, the metalloproteinases, okay, enzymes that are responsible for the breakdown of extracellular matrix, known as the metalloproteinases, okay, and they are called metalloproteinases because they strongly depend on metallic cofactors for their function, particularly zinc, okay, metalloproteinase 3, metalloproteinase 2, and even metalloproteinase 9, okay, are enzymes that degrade the extracellular matrix. And usually, depending on the nature of the tissue, you will see this degradation and this deposition, working hand in hand to ensure that the tissue is remodeled to such a way that it will suit the function of that particular tissue. Okay, so while transforming growth factor beta is inducing fibroblasts to deposit connective tissue, metalloproteinases are remodeling by degrading the connective tissue. It's just like, when you are making concrete, sometimes you have to remove some things out to ensure that the concrete is properly, fixed. While some are bringing in the concrete, the mason is having to balance it by removing excesses and all of that. So that's the interplay we see between deposition of connective tissue and degradation of connective tissue. And that is what makes up remodeling. Of course, metalloproteinases, if left uninhibited, may degrade connective tissue beyond necessity, beyond what is necessary. And so there are substances that inhibit metalloproteinases, and they are called TIMPs, okay, tissue inhibitors of metalloproteinases. And those ones also bring a balance to the remodeling of connective tissues that have been deposited. So with that, we have come to somewhat a conclusion of healing by connective tissue deposition. And then under healing by connective tissue deposition, we saw that inflammation is an important step. We saw that cell proliferation is an important step. Epithelial cells, endothelial cells, fibroblasts, smooth muscle cells, we saw that is an important step. We saw that the formation of granulation tissue is also another very important step. And the formation of granulation tissue incorporates in it angiogenesis, okay, some degree of connective tissue deposition, edema, okay, and then of course we saw that connective tissue deposition itself is a very, very important step, and of course its remodeling. Okay, the next thing we'll be talking about is the factors that affect wound healing. So what are the factors? Factors that affect wound healing? Okay. Factors that affect wound healing. Of course, there are several factors that can affect wound healing. Remember that wound healing depends very strongly on inflammation. And so when there are factors or when there are things that affect inflammation, or when inflammation is not going on properly, it can also affect wound healing. One of the things that can affect wound healing includes infection. Okay? Infection will affect wound healing because, of course, the injurious agent is still there. Okay? And of course, that may not allow the process of wound healing to occur effectively. Okay, infection prolongs inflammation and also continues to induce tissue damage. And so, of course, it will make wound healing to be delayed. Okay, another factor that may affect wound healing includes diabetes mellitus. So patients who have diabetes mellitus, okay, generally have poor wound healing because diabetes has a lot of consequences on the process of inflammation, and even with respect to blood supply to tissues. Diabetes may induce some vascular injuries. Okay, it can cause vascular injuries. Diabetes can also cause impaired immune response, and all of these things can contribute significantly to poor wound healing. What other factor can affect wound healing? Glucocorticoids, okay, so immunosuppressive medications, glucocorticoids, okay, that's steroids. Okay, steroids can affect wound healing because they have an anti-inflammatory role. They are anti-inflammatory in themselves, okay? And because they are anti-inflammatory in themselves, they may prevent or reduce significantly the generation of transforming growth factor beta by those macrophages, and of course induce worsen or make wound healing process very, very delayed, or make wound healing weak. Okay, we also have mechanical factors. Okay, so when someone is injured and continuously disturbs the injury, for example, let's say someone is injured at joints, okay, or someone who had an abdominal surgery is suffering from cough, it may delay wound healing because every time there is formation of connective tissue, those mechanical factors may eventually lead to breakdown. Okay, so mechanical factors are also factors that can affect wound healing. Okay, what about nutritional status? Okay, we all know that nutrients are important for cells to proliferate. Nutrients also, the nutritional status of a patient, okay, can also determine his immune status. Okay, and of course we have talked about the fact that one's immunity is very, very important with respect to wound healing. So when there is poor nutrition, patients will not get their wound healed as normally as it should be healed. Okay, sometimes even the site of injury can affect the nature, okay, the nature of wound healing, the nature of the way that wound is going to heal. Like we have said earlier, tissues that are made up mainly of labile cells and quiescent cells can heal by regeneration, but tissues like neural tissues that are permanent cells, like in the brain, for example, if there is an ischemic injury, you know that the injury will be different from if the injury was on the tongue. Okay, so these are also factors that can affect wound healing. What about the extent? The extent of the injury. The extent of injury can also affect wound healing. Okay, of course, mild injuries may heal better than severe injuries. So these are some of the factors that can affect wound healing. Next, we'll be talking about the different ways by which wound can heal. Wound can heal by what we call first intention, okay, which is also known as primary intention, or it can heal by secondary intention, okay, secondary intention, okay. Now, what are the differences? What are the things that differ between primary intention and secondary intention? Now, when we talk about primary intention, okay, primary intention usually happens when much of the wound is usually in the epithelial surface, and there is minimal connective tissue destruction. And one classical example is a clean surgical incisional, wound that can heal by primary intention. Okay, all right. So even though, yes, there is regeneration, okay, of the epithelium, there is also some amount of scar formation, okay, some amount of scar formation that is actually minimal, that is actually very minimal in healing by primary intention, okay. So of course, like we said, the classical example of healing by primary intention is like a surgical scar. And immediately after that incision has been made and it is closed, okay, there's clot formation. Okay. The first thing that happens is that there's clot formation, and then the next thing that happens within 24 hours, okay, neutrophils come in to clear the clot, okay. So there's neutrophilic infiltration, okay, neutrophilic infiltration, and then between 24 to 48 hours, okay, there's epithelial proliferation, okay. So the epithelial cells begin to proliferate, and of course, soon enough, they close off the injury. By the third day, okay, the neutrophils are replaced by macrophages, okay. And of course, these macrophages, like we all know, will stimulate the recruitment of fibroblasts, okay, so that by day 5 we begin to see granulation tissue formation, okay. Over the next 1 week, that's 7 days, okay, we will have connective tissue deposition, okay, in that area where the connective tissue has been injured, and connective tissue deposition by day 7, okay. And then, of course, over the next 1 month to 2 months, there's remodeling, and the strength of that tissue returns, okay. That's basically what happens. At the end of the day, okay, the epithelium will completely cover the injury, and there will not be scar formation. It will look very clean, as if nothing had happened before. Now, that is what happens in healing by primary intention. But in healing by secondary intention, there is a lot of tissue loss, okay? There's a lot of tissue loss, or there's significant destruction of the extracellular matrix. And much of what is going to happen is that there will be a maximal amount of connective tissue deposition. And sometimes the epithelial cells may not proliferate enough to completely cover the wound. And so what we see is a scar formation. Of course, there's regeneration of epithelial cells, even in healing by connective tissue deposition, but it is not enough to completely cover the injury because of the amount of tissue that has been lost, or because of the amount of destruction that the extracellular matrix has experienced. And so much of what happens in healing by secondary intention is connective tissue deposition to replace the damaged tissue, and of course to return the strength of that tissue, even though the strength of that tissue never really returns to 100%. Sometimes we can get up to 80%, but it never really gets to 100%. And finally, we are now going to talk about the complications of wound healing. All right, so the complications of wound healing can arise from defective blood supply or drainage, okay, and that can lead to delay in wound healing, or that can lead to poor wound healing. And this can happen in cases where it is the vessels themselves that have led to the development of the injury. For example, in arterial ulcers, and venous ulcers, we can see problems with wound healing in that situation. Pressure sores, okay, where pressure, okay, compresses blood vessels and leads to the formation of sores. Now, it is going to be very difficult for them to heal, especially if there is still pressure, okay, on those blood vessels. Sometimes wound can heal excessively. There can be excessive wound healing, okay? And when wound heals excessively, maybe because there's excess deposition of connective tissue, we get to see exaggerated scars like hypertrophic scars, okay? These are large scars, but they are still within the line of the injury. But when they begin to cross the boundaries of the injury, these scars will now be called keloids, okay? Okay, so they are very large scars. They even look like masses. Sometimes you see them very commonly in this environment because one of the risk factors for the development of keloids is the African race, okay? So we see them very commonly in this environment. So wound can heal excessively. Sometimes it may not be scars, connective tissues that are deposited. It may even be that there's excess granulation tissue. So excessive granulation tissue can also be present, okay? So excessive granulation tissue can be present, the so-called proud flesh, okay, proud flesh. And this one will require surgical excision for the wound to heal properly. We can also have defects in wound healing, okay, like contractures, okay, where there is, for example, in patients who have had burns, okay, you will see that they won't heal with serious contractures that has caused their joints to be stiff. Okay, so those are contractures where there's connective tissue to such an extent that it impairs, function and movement, particularly of joints. Sometimes, okay, wound healing can also break down, okay, what we call wound dehiscence, okay. So wound can break down, okay, because of weakness, okay, or because of some of those mechanical factors that we talked about, okay. So these are some of the complications of wound healing. Before I close, I just want to tell us that some other factors that can affect wound healing include the presence of foreign bodies within a wound, okay. So when there is foreign body, it may continue to irritate, the tissue and continue to stimulate inflammation, and so wound will not heal very well with respect to those foreign bodies. And then another factor that can affect wound healing is poor perfusion, which we have seen that it can lead to complications in wound healing. Okay, so these are factors, so we can add to those factors that I mentioned. Now, with this, we have come to the end of our discussion on wound healing and tissue repair. I thank you very much for watching, for joining Pathology in a Nutshell. I would like for you to subscribe. I would like for you to tell your friends about what we do in Pathology in a Nutshell and to expand our community. Thank you very much, and I'll see you in the next one.